Now, dementia's risk factors are basically many. I mean, most of these are lifestyle disorders and they are reversible and correctable. Now, one of the major concerns around dementia prevention, which we have started now in the UK, is around looking at these risk factors early on at the age of 40 to 60. It's important to address these risk factors because changes in the risk factors have a large bearing on how and when you can develop dementia. So, hypertension, diabetes, alcohol intake, physical activity, smoking, hearing loss, and nutritional issues are all attributed. There are many others, but I wanted to focus on these aspects. Early onset dementia is something that is largely being missed in India because we do have a large population who have neurodiverse concerns like people with cerebral palsy, people with autism, people with learning disabilities. Because the brain is already affected, even people with epilepsy, because the brain's already affected, there's a larger issue where you can have dementia developing on early on because of the way these neurodiverse conditions affect the brain. So because that will then directly affect your memory concerns. So that's important to kind of keep in mind that if somebody at a younger age of say 30 or even younger starts developing issues around memory, you should also think of dementia in that particular case. You might come across younger people with autism and with learn disabilities who come to you, and then you might see them having issues around memory. They might be reacting differently. The family members might be telling you that this is something that is happening. We don't understand what's going on. So that could be one of the triggers that might be developing early onset dementia. So it's important to keep in mind that hearing loss I'll mention as one thing. If you know anybody who has hearing loss, the cycle of hearing loss and advancing dementia is very critical because it creates more confusion. They're not able to understand stimulus, so it causes more concerns and advances dementia at a much faster pace. So, what we always recommend here is that anybody with hearing loss deal with the hearing loss as soon as possible because then it can actually reduce the onset of dementia or the progression of dementia in the long term. It's very challenging again because a lot of older people forget to use their hearing aids. So it's important to prompt them, motivate them, help them understand and explain to them about these concerns. Now, when we come to the main, this is, yeah, so this is I think that slide popped in there by mistake. But I talked about managing these risk factors, right? So early on, we kind of look at exercises and engaging activities. I think with dementia prevention, exercise, engaging physical activity is one of the most important aspects. There are studies where they've attributed the amount and total of muscle mass attributed with correlation with dementia concerns in later life. So that means if you're exercising with some level of physical activity, has a larger bearing on how you uh, have the prevention of dementia in the long term. So these are some things that to be kept in mind. So it's something that you have to look at even from a personal life's point of view, because most of us are at the same age, about 40 to 60, this generation. So we have to kind of keep these in mind. But some of these activities can be done even early on. Engaging in activity is important when you come to stimulation of mind. So learning becomes a very important aspect of your day-to-day life. When I say learning, it could be anything. It's not just generally reading for your work. It could be reading books, but it also looks at stimulation activities from your things with regards to hobbies, gardening, cooking. I play the guitar, learning a new language. All these help and build up a stimulation of mind. So it's always important to continuously learn and build up things. Now, this has a bearing in terms of rural sectors, right? We think that okay, a lot of people are uneducated, they don't go to schools, but it doesn't mean that not having access to education is something that is not going to engage stimulation. People in rural sectors can also look at other things. They can look at vocational training. They can come into mainstream vocational level work where they look at say technology, learn computers, small things like this. It also helps with people who are living with dementia. Say for example, you engage them with puzzles and things that they are engaged and they love doing. Sometimes I'll give an example. I had a client uh, who was a teacher who didn't want to do any puzzles or didn't want to do any of your regular activities that they would do in these dementia care centers. So we started asking her about her regular routines. I asked her one question. I said, what is something that you can tell me that you absolutely love? So she goes to a library, and she had a big library, and she brings this thick book. It was about the Beatles, and she says, when I was younger, I was a Beatle fan, and I love the Beatles till date. So what we did was we said, "Okay, fine, would you like to sing the songs?" She said yes. So we developed a YouTube playlist of a sing along where she would basically, on the days where she would not go outdoors, she would sit with the computer and with the care work, and then she would just look at that and sing the songs, listening to the tunes. So that is basically again a stimulation activity. So it's something that can be done person centric. uh, Balanced diet is something that is across the board. We have to look at trying to make sure that we avoid salt, fat, sugar, red meat in larger quantities. It's not that you don't have to eat it, but it's fine to moderate these things because again, these have correlation on heart disease, on vascular dementia, and all these other aspects. Uh, Alcohol intake has had some benefit in smaller quantities, but reducing alcohol intake and smoking cessation are very good in terms of preventing vascular dementia. There's also a specific form of dementia that is as a result of chronic alcoholism. So that's also something to keep kept in mind. So the ones highlighted in blue are your types of dementia. Dominantly, when you look out there, these are the major forms of dementia. Alzheimer's and vascular dementia form almost over 80% of the dementias out there. You do see a lot of Lewy body dementias, temporal dementias, but you also see mixed dementias. You might have people who have vascular dementia with Lewy bodies, and so you have a lot of these aspects as well. Now, some of these characteristics around that is you have to understand that the symptom presentation is very different based on which part of the brain is affected. So Alzheimer's basically sets up these tau proteins in your brain, and it basically affects more on the temporal side. So you have issues around spatial issues, you'll lose memory, cognition becomes issues. Vascular dementia will have a lot of cognitive issues. Forgetting day-to-day tasks, your routines get affected. With Lewy body dementia, one of the stark, factors is this person basically starts having auditory and visual hallucinations. They feel that there is somebody in the room telling them that they have issues. This again can be differentiated because some people might think this sound looks like schizophrenia. So it's important to kind of understand how the presentation is kind of built up and everything. Mixed dementias will have more than one dementia present in that particular case. So it's always important to kind of look at things. There are some of these other dementias that's there, in terms of Parkinson's related dementia, where you will see people having motor, that typical cogwheel motion, but also have dementia. And this is very challenging because when you look at treatment, it is very challenging with Parkinson's dementia because you can either deal with the cognition, where you make person less foggy, or you deal with the motor issues, where you make sure that they're more active. People with Parkinson's dementia have one thing they love doing. They love wandering. So they will basically step out of the home and they will have issues. They will do things that are beyond their capacity sometimes, making them more tired and there's issues around those things. But then it's always difficult with the treatment parameters. From experience, I can tell you that somebody who's got brain fogginess, who's able to mobilize, they will not understand wandering out, onto the road. They might go out, they might get lost. So that's important to kind of keep those things in mind. I won't go into details of the other ones, but they are the ones that is again associated to some extent. There are very rare forms that are there, but that's one of the aspects that are there for the types of dementia. Now, we all know that dementia is associated with memory loss, but it's also to do with the way we are thinking, our judgment, how quickly we are thinking about things. So, reaction time. And these symptoms form the basis of your assessments because dementia is largely a clinical diagnosis, but you have MRIs, PET scans, CT scans to help you look at the brain, and then you can have a more definitive diagnosis with regards to things. But we all know that you can't use MRIs, CTs, and PET scans regularly for screening because they are really expensive. So clinical diagnosis is large. In the UK as well, waiting in line for your dementia diagnosis might take 6 months because it is not a priority to use the PET scan and MRIs for these at the moment. They're still working on clinical data around these. The Sweden study that has been looking at biomarkers for dementia. So that's something that has been done. So there are two studies being done in the UK at the moment. So you will also have issues around, issues where people have mood disorders, difficulty in doing daily activities. And this is also important to understand, to differentiate symptoms of dementia with, say, a new infection. And that is very critical. Like one of the biggest examples I always talk to my care workers about is that when somebody develops a UTI in the elderly, when you and me develop UTI, we'll be irritable, we'll have confusion, which is part and parcel of how any disease or any infection takes on to you. Now, with people with dementia, that confusion or that cognitive issue kind of is more pronounced. It's always a new thing, and people who work regularly with them are able to look at differentiating that and identifying this as an early diagnosis is the difference between them uh, going into treatment or them going into a longer treatment aspect where they've not been addressed and they go into, say, an early sepsis, hospitalized, and then their movement parameters all decrease, so bringing them back to baseline takes a lot of time. So it's important to kind of look at these aspects early on, and that's why dementia training is very important, to identify these concerns early on. Now, as I mentioned, medical history and the mental ability tests are predominantly used for actual diagnosis of dementia. So these are things that are done for in terms of assessments, but there are associated blood tests. They look at liver functions and other, whether there's diabetes, there's hypertension, blah blah blah. Brain scans are more the definitive ones that are used, but again, they are intensive. Now, the blood biomarker for dementia, there are two studies that are being done right now in UK. I can't talk about where other studies are happening. I don't think there are any studies happening in India. But the readout study and adapt study are basically two different forms of studies where they are basically trying to look at testing these biomarkers and getting data on this in the UK. They are hoping that in maybe a year or two they'll have something definitive to actually look at uh, these biomarkers for this. The original study is basically done in Sweden, uh, where they basically looked at tau proteins and these what do you call it? The components will basically come out in the blood. So they're basically looking at these biomarkers from that. So that's how the original study has come into play. So it's important to kind of keep in mind that this is basically what happens with regards to dementia. Uh, Now the treatment, I won't go into the actual treatment. If you want, I can send you resources around that. But predominantly, dementia has medication, to actually treat the dementia itself to kind of make sure that is there. But there could be other related disorders like hypertension, diabetes, et cetera, for which also treatment is managed. Uh, and then there are concerns around behaviors with challenge. So people in late stage dementia or mid stage dementia will start showing, verbal abuses, physical abuses. They can be very difficult to deal with because they're not able to understand what's going on. So it becomes very difficult. So in this particular case, you might have to give them tranquilizer-based medication, which is also detrimental because it creates more confusion. So it's very important to kind of keep the medical point of view in mind. But then there are also non-medical treatments that are equally important as a part of dealing with dementia. You have cognitive stimulation therapy where you are basically working with them in a focused way. It could be done by care work who is also trained by somebody who's a counselor, but you understand who the person is and then you build up these stimulation activities around that. Could be anything, could be engaging in hobbies, could be engaging in, puzzles, engaging in social gatherings, sing-alongs, things like that. Cognitive rehabilitation is something that physiotherapists or occupational therapists would do. This involves helping them redo or meet targets around your day-to-day activities. Simple thing like lifting a cup from table to sipping it seems a very easy thing for us to do, but with people living with cognitive issues, it's something that they might not able to understand. So it's something to kind of build up around that to help them build those muscles to try and relive the routine. Lip muscles get developed. So it's important to kind of keep that in mind. Reminiscing and life story is what I mentioned earlier as well. So when people are basically losing most of their recent memories, it's important to build up this life story. And this is something we do when we do our care assessments. We understand what routines are, and then we'll go back historically in terms of understanding who this person was, what did they do, where did they live, did they like to do some hobbies, and then we build those things around that. It's important to kind of have a journal around this, having photographs, so that whoever's working with these clients, even with family members, they understand these aspects and reminisce. Now, reminiscing is good from two perspectives. Reminiscing can make somebody sad, reminiscing can make somebody happy. So it's important to understand that both negative as well as positive reactions to reminiscing is beneficial for the person, because it creates stimulated environments and they kind of relive a memory. So it's very good for them. So, it's very important to kind of look at these aspects from that perspective. Aromatherapy, music therapy, also again non-medication treatments. Why these are important is because sometimes people. Sorry, somebody want to say something? Okay. So sometimes people have memories associated with smells and music. I mean, when you maybe had a special event for your parents, for example, or if you remember the first, your loved one you met or your partner that you met, you remember there might have been some music in the background. That always triggers a memory around that particular aspect. For me, I mean, whenever I hear, the theme music from Notting Hill, it always remembers the first time I met my partner, my ex-wife. So it's always important to kind of reminisce those understandings from this perspective. Uh, so, the other senses also help because there are different pathways. The brain is a very confusing thing, and they're still learning a lot of the brain. Sometimes somebody might not have a recent memory in mind, but they might remember the smell of, say, bread, toast and marmalade, and they